Today's topic is acupuncture versus dry needling. Sally, I'd like to teach you about dry needling. A technique that physical therapist created to treat muscle pain. I insert a needle into the trigger point rapidly to release the muscle.
Joey, I already learned that technique in acupuncture school. We call it lifting and thrusting ashi points. "75% of my profession use it on a daily basis in treatment."
Sally, but dry needle is not acupuncture. We use medical terms, not mystical words from thousands of years ago. I learned to dry needle in a weekend course taught by a physical therapist.
Joey, acupuncturists use medical terms to the Chinese were where the skeletal system. They wrote about treating the muscle trigger points with needles in a book published in 220 AD.
Okay, but I am not doing acupuncture. My teacher told me it was not acupuncture. And I don't call it that, so it can't be the same thing.
Joey, kneading into trigger points was one of the 100 different needling techniques I learned during my 3000th master degree program in acupuncture. I use this often on patients.
Sally, but you did not learn about Western medicine concepts. And dry needling is based on Western medicine, so it can't be the same thing.
Joey, yes, I did. My degree required hundreds of hours on Western clinical science, including anatomy, physiology, clean needle technique, bloodborne pathogens and contraindications.
Okay, I am not required to learn those things if I want to dry needling. I just have to take a 12-hour continuing education class over the weekend and I can needle a patient that same day.
Joey, using a needle to break the skin surface is included in my scope of practice by the legislature. I must complete a master degree and register with the licensing board to treat.
Needling is not included in my scope, but the physical therapy board said it was okay as long as I feel competent in whatever training I choose to do. That weekend course was enough.
That doesn't sound safe. Even the doctors in my state must complete a 300-hour approved program and register with the board of medicine before they can do medical acupuncture.
Sally, but since I don't call it acupuncture, that should be okay, right? I don't need to have any specific training to needle into the skin like a doctor does.
Well, the doctors already know how to use needles, but they must still do an additional 300 hours if they want to lift and thrust ashi muscle points, no matter what they call it.
But it works so well on my patient. I want to be able to do it and to build their insurance company for the procedure.
Yes, it does work well. That is why I went to acupuncture school to learn this and many other techniques, so that I can choose the most appropriate technique for their issue.
Are there many needle techniques besides dry needling that might help resolve muscle pain?
Yeah, many. Why don't you stick to manual therapy and refer your client to me for needling? We can both help the same patient by doing what we were trained to do best. Attention, dry needling is not manual therapy and technique. It is acupuncture. It is unsafe for the public to do dry needling by physical therapists taught in a weekend course. Thank you for watching.